Everyone progresses at different rates. There are patients at 3 months who are absolutely delighted with their knee replacement and are back to gentle sports and have very little pain. However, many patients at 3 months still have an ache and a pain and still aren't at the level they'd expect to be. In fact, most of the research suggests that patients go on improving up to 18 months. So you shouldn't be alarmed if you're not progressing at the rate of other people who've had it done, and it's a very individual process.
Most people should expect not to be driving for 6 weeks. We would hope that the vast majority would be able to get driving again at 6 weeks.
The results from knee replacement are such that we're hoping to reduce pain, so we're not going to get rid of all pain. Patients that are requiring this type of operation are in severe pain, and we're trying to get that pain down to a very manageable level. Probably not get rid of all of the pain, but hopefully reduce it very significantly.
From 6 weeks to 3 months, most patients can start to walk without aid, so they're getting rid of their sticks or crutches or frame. You should by that stage have a reasonable range of motion in the knee, although that goes on improving for many months and even after a year.
You will be very pleased with your new knee if you realise that there will be some limitations and aspects where it is not normal.
Most of it is there by 3 months, so you're beginning to really enjoy your new knee. You're more active, you're out, you're doing stuff. That improvement then continues for about 12 months following the surgery, so you can still continue to improve for up to a year following your knee replacement in terms of the range of movement, the discomfort that you get following the surgery, and so on. In terms of kneeling, sometimes that just isn't possible because of the scar down the front of the knee, and to get round that, patients get knee protectors, or if they're working and they need to get down on their knees, more often it's full gardening, and we just advise kneeling stools and so on.
We would advise you to try and avoid sports where you do constant repetitive load bearing and jumping around. So sports like squash, badminton are not wonderful for knee replacements. Gentle tennis, we don't have too much trouble with, probably doubles rather than singles in the future. But we don't really restrict anyone in anything. You have to be aware that the more you do with it, the more likely it is to wear out, and you might wear it out, storing yourself up a bigger operation in the future.
It will never feel quite normal. However, patients go on improving for a year to 18 months, and that's been well shown. So if you feel that your recovery is disappointing at 3 months or even 6 months, one shouldn't be too upset by that. And if your surgeon's reassured you there's no major problems, as I said, you will go on improving, particularly if you work hard at the exercises and so on.
By a year, most people have forgotten that they've had their knee replacement and are happy with it. The swelling should have completely settled, and you should have very little in the way of symptoms. 85% of patients are delighted with their knee replacements. 15% of them are not quite as happy as they hoped to be in the first place.
It's very important for a good outcome in a knee replacement to maintain the strength of the muscles and that range of motion which you have. So initially you're exercising every day, and for the 6 weeks to 3 months after the surgery you're exercising several times a day.
We'd like you to stay active as long as possible. It keeps the muscle tone good. You don't have to be religiously coming to physiotherapy, hopefully much beyond 5 to 6 weeks. But we'd like you to get into a habit of doing these exercises fairly regularly on a daily basis, and that will keep the knee replacement going, keep your health good for the rest of your life.